Hi, my name is Alexis Cooper, and I am an SPC E683, Section 807. And today I will be discussing a client that I work with currently in the semester and the assessments that were ran when she was first diagnosed, as well as her reassessments that have taken place since then. So first, I want to start with a general description of my client. She is a female aged at 4 years and 1 month. She has a diagnosis of autism spectrum disorder. She was first diagnosed when she was 3, and she currently attends daycare Monday through Friday from 8 a.m. to 1 p.m. Right now, her recommended services are direct ABA therapy one-on-one 30 hours per week, which I do primarily. We do ABA services both in the daycare setting as well as in home when daycare is not in session. So to start off, I just want to give an overview of the assessments used to diagnose my client, as well as give an idea of what type of interventions needed and what type of skills she already attained and the type of skills that needed to be worked on. So her initial assessment was conducted in September of 2023, and in that initial assessment, she was administered the VB map as well as a functional behavior assessment. This was then updated in February of 2024. Again, she was re-administered the VB map. She was also administered the socially savvy assessment. Well, that was done via parent interview. The Vineline 3 assessment was done by her parents, and the PDD-BI assessment done by her parents. So to start with the first one, the functional behavior assessment that was done back in December, um, there were 3 tools utilized for this functional behavior assessment, including the functional assessment interview with the client's mother, the motivation assessment scale, MAS, and the direct observation done by the BCBA. The behavior of concern was tantrum behavior, which was defined as throwing oneself on the floor or hands, pouting, crying, um, and the hypothesized function was tangible access to items. So as you can see, these are her actual results from the MAS, and tangible scored 15, while attention, escape, and sensory all scored 0. So here you can see that the results did support the hypothesized function of the tantrum behaviors to tangible access. Now I want to discuss the VB map, which was initially conducted in September. When she was first diagnosed with autism, my client scored 22 out of 170, falling in the level 1 range. Just 6 months later, after services had began in the daycare setting in February, my client was administered this assessment again, the VB map, and she scored a 128.5 out of 170. So she jumped 2 levels into level 3. I also want to make some key points and differences that were mentioned in the interviews with both her assessor and the interview and the parents, which were the differences in spontaneous functional communication, which were not present in the initial interview or assessment, but now are present 6 months later and now, as well as number of words that are spontaneously uttered, which were 2 to 3 words before, and now she speaks in 2 to 3 sentences at a time, as well as acknowledgement of those around her, including the assessor on the screen, listener responding skills when she's called by her mom or her teacher. So those are pretty big jumps that she made. I also wanted to give so this is her actual VB map. So as you can see, she mastered out of level 1 and level 2. And she actually mastered out of a lot of different categories in the level 3, but still does need work in MAND, writing, linguistics, other things that you can see there. So the VB map was important to re-administer even just 6 months later, because after the implementation of our intervention of functional communication training and putting, tantrum behaviors on extinction, she really did make a lot of progress. Um, and that was important to consider as she moved forward in her intervention services. So moving on, I want to go and talk about the Vineland 3 assessment. Um, and the reason we use this assessment is because I think it gives a more realistic measure of a client's adaptive behavior. As it says here, it gives a standardized measure of a client's adaptive behavior in everyday life rather than just a clinical setting. So a lot of these assessments are ran by clinicians, sometimes through telehealth, such as this over computer, or they're run in a clinic. And at onset of diagnosis, the clinician may not have built a rapport with the client, and that can often mask a lot of the skills that are um, available to the client. And so this one is done usually by a parent or a caregiver, and this was done by my client's mother back in February. So it just gives, it's still standardized measure, but it gives a more realistic a representation of their adaptive behavior. So as you can see on the adaptive behavior um, composite, her score was 91, which is pretty high. The normative is 100. And there are 3 subcategories that make up that composite score. So there's communication, daily living, and socialization. She scored pretty high in communication and daily living. Daily living was actually described as a relative strength, so 98, 96 respectively. And socialization, she did score an 87, a relative weakness. And I'll come back to that point later when we talk about her PDDBI assessment. So moving forward, like I just said, when she was diagnosed with autism spectrum disorder, she was not initially gave this assessment until a follow-up in February. And this was conducted by her parents and her teachers, and it's the Pervasive Developmental Disorder Behavior Inventory. And this was important to administer to my client in particular because she does not have those sensory and ritualistic behavior characteristic of people with ASD. But she does have those social pragmatic problems. So going back to that social subcategory of the ABC composite score. She did score fairly low in that compared to neurotypically developing children, and therefore that is going to be a focus on our interventions. Much of her interventions right now are social, so we're teaching her functional communication as well as teaching her, ways to interact with her peers in the daycare setting, with her teachers, with her parents, and also put those other um, maladaptive behaviors on extinction. So I hope that gives you a broader picture and general idea about the client that I am working with this semester, as well as the assessments that we used in order to um, enlighten our intervention programs for her. Thank you.